The sooner we can all get back to life. Let's strike gold like our Olympians, Jamaica. That was a message from the Ministry of Health and Wellness.
COVID has stressed me. Do take the vaccine.
And through it all, our healthcare workers have been the real MVPs tackling COVID-19. Caring for you is our priority. As frontliners in the pandemic, they got vaccinated.
I got the vax. I had to protect myself so that I can protect you. No, sir?
Me, stop for it because my vax up.
I made sure my mom and I got the vaccine. Protection is key.
Me, vax up, me stop for it.
Fam, help us protect you,
your family and friends.
So should you.
Enough now. Take the vaccine.
Get vaccinated. Get back to life.
Become the hero on the scene by taking the COVID vaccine. Get vaccinated as soon as you get all the facts. Don't listen to the rumors. This vaccine might just make it possible for teachers to sit face to face with schoolers. This vaccine make it safer for everybody, from the young to the elderly. Don't you want to go back to living normally when things were more orderly? And if you want to live a long good life, then we all have to do what's right. So let's get vaccinated along with the heroes on the front line.
A message from the Ministry of Health and Wellness.
Hello, Jamaica. I'm Dion Jax-Miller. It's unbelievable to me whenever I buck up somebody who is still asking if COVID-19 is real. Because my doctor died of COVID-19. I had COVID recently and it was a severe case. Most of my lungs were affected. I am so grateful to be alive. Take COVID seriously, guys. Some people won't be affected, that's true, but others may have long-term effects and some people will die. Let's do all we can to protect ourselves and to protect others.
A message endorsed by the Ministry of Health and Wellness.
Severe pains, shortness of breath, worsening with fever, lack of appetite, extreme weakness, and overall grazing beside death's door. This was my experience with COVID-19. Hi, I'm John, and I'm so thankful that I survived COVID-19. As an asthmatic person who lives alone, I know that COVID could have claimed my life. Listen. Don't drop your guard with COVID-19. It only takes a second for you to catch a virus. Initially, I thought I had the flu until things got worse. Don't leave your mask, wash your hands as often as you can, and always keep a physical distance from others. And I want to tell every Jamaican to choose a vaccine before COVID chooses you.
A message endorsed by the Ministry of Health and Wellness.
Good afternoon, members of the media, ladies and gentlemen all. I am Petra Williams-Rayner, Manager of Public Relations and Communications here at the Ministry of Health and Wellness. Welcome and thank you for joining us. We are led in today's press conference by the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, who is supported by Mr. Dunstan Bryan, our Permanent Secretary, Dr. Jacquiline Bisasor McKenzie, our Chief Medical Officer, Mr. Howard Lynch, our Chief Technical Director for Policy Planning and Development, and online other members of our clinical team. Without further ado, I hand over to our Minister.
Okay, thank you very much. Good afternoon, colleagues, members of the media, other Jamaicans who are online listening. Jamaica has its first confirmed case of monkeypox. The patient is a male who recently traveled from the United Kingdom. He presented to the public health system on July 5th, having arrived on the island some 5 days earlier. The patient has been isolated, having confirmatory tests done, and his close contacts quarantined following contact tracing, which will continue if necessary. The confirmation of this first case has triggered our emergency protocols in line with international health regulations protocols. Among other things, our Emergency Operations Center has been activated. A review of all isolation facilities is to be done to look at the capacity to manage both monkeypox and COVID-19. The necessary health protocols, including surveillance, clinical management, lab management, as well as infection prevention and control, are being completed for the distribution to health teams island-wide, and sensitization of the health team and members of the public, which began more than a month ago, is being enhanced. Monkeypox is a viral disease caused by the monkeypox virus, MPXV. The first human case was confirmed in a child in the equatorial region of the Democratic Republic of Congo in 1970. Since then, sporadic cases have been reported from the rainforest areas of Central and West Africa, while large outbreaks have occurred mainly in the Democratic Republic of Congo, where the disease is currently considered endemic. The United States has had a number of imported cases. This year, in addition to the United States, the World Health Organization has reported cases in Australia, Belgium, Canada, France, Germany, Italy, the Netherlands, Portugal, Spain, Sweden, and the United Kingdom. The spread of monkeypox may occur when a person comes into close contact with an infected animal, rodents. Person-to-person spread is generally uncommon, but can occur through direct contact with monkeypox skin lesions or scabs, contact with clothing or linen, such as bedding or towels used by an infected person, coughing or sneezing of an individual with a monkeypox rash. The virus enters the body through broken skin, even if not visible. The respiratory tract or the mucous membranes, that's eyes, nose, or mouth. The incubation period, as we understand it, is between 5 and 21 days. Symptoms are usually mild to moderate and include fever, intense headache, lymphopathy, or the swelling of the lymph node, back pain, muscle ache, or general lack of energy, or a rash. We certainly advise and encourage Jamaicans who may be experiencing any of these symptoms to see their medical practitioner for examination and advice. The CMO is available to provide greater details on the clinical presentation of the virus. Are you going to do that now, or should I complete? Okay, so just to say that there is no present recommendation for the vaccination of the general public. If you are experiencing fever, intense headache, muscle aches, or rash on the skin, you must isolate immediately. Call ahead to your health center or doctor before visiting. All members of the public should wear a mask, ideally where you feel exposed, normally in public. Frequently wash hands and practice physical distancing. So the protocols are pretty similar to the COVID-19 virus. In addition, information on monkeypox, members of the public can visit the ministry's website at www.moh.gov.jm. So that's www.moh.gov.jm, or you can contact your local public health department. Of course, if you visit sites such as the Pan American Health Organization or the World Health Organization, you can get additional information on this particular disease. I want to close, before I ask the CMO to comment or open the floor for questions, to say to Jamaicans, this is not a reason to panic. It's not a reason to be uncertain or scared. We are informing you as soon as we got confirmation so that you are aware. And I think we have a duty to make you aware. But this information is not intended to cause anyone to be unduly alarmed, except that personal responsibility requires that you protect yourself and that you are observant sufficiently to understand if you think you are threatened either by a third person or you feel threatened personally based on symptoms that you have. It is business as usual in terms of the functioning of the economy. The Honorable Prime Minister and I spoke, and he is ready, always able, as you know, to provide the leadership and the guidance that is necessary. The Cabinet has been informed. And again, the need for the swiftness of the information is out of a duty to inform the public, but not to raise any undue alarm. We will continue the public health infrastructure, our nurses, our doctors, working with other stakeholders if necessary, to monitor, to provide information. We did start 4 weeks ago to provide information when the monkeypox alarm was raised in the global community. We had intensified that somewhat based on information coming out of the WHO, and you will see more information going out in the days and weeks to come to keep the public informed as to the status of the disease beyond the one case that we now have, if necessary, but more importantly, to provide information so Jamaicans understand what their own role and responsibilities are. So I will stop here and open the floor, or if CMO you want to add anything to what I've said, I'll allow the CMO to add any additional information. Thank you.
Yes, thank you, Minister. I think I don't want to repeat anything the Minister has said, but I just want to stress that the monkeypox disease is in fact a mild disease for what we are used to and what we have been seeing so far across the world. The WHO report at the end of June had in fact recorded about 3,500 cases, and there was only one fatality of these cases. So it is fairly mild disease. However, the public needs to be aware of the risk of getting the disease, and so therefore to take the necessary precautions. This press conference is about increasing awareness so that, for example, travelers that are coming in, persons would, if they would develop any kind of symptoms, any kind of rash, then you should seek help. You should stay home for the first part, isolate yourself, and you should inform your medical practitioner that you're coming to visit so that the necessary precautions can be taken. And protect yourself, of course, when you go out from the risk of, protect others, I should say, from the risk of getting the disease by covering any kind of rash that you have. And, of course, wearing a mask. The fact is that if you are carrying out the COVID precautions in terms of wearing the mask, keeping your physical distancing, then you will prevent the spread of monkeypox as well. So I would just say also that over the next couple of days, couple of weeks, we will be ramping up our communication campaign in our health facilities, in the media, and of course increasing the awareness of our clinical healthcare workers in order for them to be able to provide help to our clients. So we will be having increased awareness sessions for our healthcare providers as well. So all of this information, I'm asking the public to be recipient to the information, educate yourself so that you can protect yourself from getting monkeypox. Minister.
Thank you very much. So the floor is open now for any questions to the media online.
We invite the members of the media to use the raised hand feature to facilitate your questions. The first question this evening goes to Roxroy McLean from the Jamaica Gleaner. Roxroy?
Hi, good evening. Good evening, everyone. Minister Tufton, granted you said it is business as usual, but can the ministry foresee a COVID-type lockdown to contain spread of the monkeypox, one? And two, is there a risk that this that this will become an endemic?
All right, so I'll ask the CMO to deal with the clinical aspect of the question, but I am confident that given the nature of the virus, given what has transpired globally to date up to this point, discovering one case doesn't make or create a crisis. It certainly creates concerns. And indeed, we did expect, this is the health authorities, us here, that given the presence of the monkeypox disease on the global landscape, given the openness of our country, we travel a lot for business or otherwise, that there was always the possibility of a case turning up here, a case or two. Having said that, we do believe that we have the capacity to respond, and particularly if Jamaicans play their part. And so I do not envision the kind of response to the novel coronavirus when it came on in March 10th, 2020. I believe that we can manage this current threat, and if we play our part, we can manage it in a way where we can continue to live our normal existence and go about our business, whether play or otherwise. And I believe that that is possible. So I would say to Jamaicans, just play your part, play your part. God knows the country cannot deal with another extremity. We have enough side effects up to this point from the COVID-19 pandemic. So we're not only going to pray and ask God for guidance, we're also going to work and ensure that that kind of guidance is taken advantage of by ourselves and the role that we play. And I'm confident that Jamaicans will appreciate the need for this. As it relates to whether it will become endemic, I doubt it, but let me leave that to the clinical minds. CMO, you want to weigh in on that?
Yes. Certainly there is a lot different what is happening now with monkeypox transmission than what we're used to. For example, monkeypox is known to be mostly an animal-to-human transmission, and we're seeing more human-to-human transmission now with these cases that we're seeing across the world. So there are some changes, but these are still being investigated. What we do know is that monkeypox is not easily transmitted and requires close contact and close prolonged contact for transmission to occur. So the other thing is that you have the visual, unlike COVID, you actually see the rash, although we are having some cases now that are a little bit atypical in their presentation, but you do have that visual effect. And so what we need to do is to break transmission. And how do we break transmission? We break transmission that if persons display symptoms, that they isolate themselves. And as I said, because it is not very easily transmitted, if we just do that, then we are able to prevent the spread of monkeypox here and, of course, remove any possibility of it becoming endemic in Jamaica. So, and again, this is a reason for increased awareness so that persons are aware of the symptoms, they are able to isolate themselves and to prevent transmission.
Thank you, CMO. Thank you, Minister. The next question goes to the observers, Jason Cross.
Yes, thank you. Good evening, Minister. Good evening, CMO and everyone else. Remind me, where does this person live and what has contact tracing shown so far? How vigorous has it been? And just give us, at least 3 proper reasons why we should not panic, Minister.
Okay, so as the Minister has said, the case that we have is in the parish of Clarendon, and we would have started the contact tracing and would have quarantined the very close contacts. Now, In terms of specifics of the patient, we're not going to give this information because we do not think that it is necessary at this time. As we have mentioned, the case has been isolated, the contacts have been quarantined, and we do not anticipate any risk to the communities that are involved. In terms of what was the second part?
Second part about 3 reasons why we should not panic.
Okay, and that's the reason for not panicking, because we don't anticipate any risk. So our persons are on the ground as usual. We are very good at contact tracing, and we will uncover the cases, and we will do our work to ensure minimize the chance of spread to the population. Again, to reassure that this is a mild disease and it does require very close contact for transmission. Those are other reasons why persons should not panic. The other reason, again, as I want to emphasize, is that if you become sick, this is something that you can see, and therefore you are spurred to action immediately in terms of isolating yourselves. Okay?
And the other reason, Jason, is that panic leads to chaos. And we're not trying to promote chaos. We're trying to promote responsible behavior in light of the new development, which is why it's important to outline that this is the case. But again, once we follow the protocols, we should be able to work our way through it.
Thank you, Minister. Thank you, CMO. The next question goes to the Jamaica Social.
Hi, good afternoon. Are you hearing me clearly?
We are. Go ahead.
Okay, I'm Cassius Watson for Jamaica Social. Just any linkages as yet to we've seen where it has been linked to people with certain sexual preferences in the United States. The bulk of the cases there. Did you go as far as to investigate the person's sexual behavior or anything like that? Was that part of your screening process or questioning of the person who has monkeypox? Thanks.
Well, first of all, I want to say that monkeypox is not a sexually transmitted disease. The lesions, the rashes, the vesicles, they can be present on any part of the body, including the genitalia, and therefore they will spread through close personal contacts. However, we have noted, and scientists all over the globe have noted this connection, and of course are investigating to see if there is actual transmission through sexual fluids. However, we have not had any confirmation of that as yet. So, but close personal contact, including sexual contact, which we all know is close, will pass on the disease if it is that you have the vesicles present. So it is, I want to reassure the public that this is not a sexually transmitted disease. It's a close contact transmission, which can occur in any kind of close encounter. A sexual history is a part of a medical history that every doctor takes in carrying out their history taking. And of course, in doing public health investigations, case investigations, we do pay particular attention to our history taking and make sure that all our bases are covered. Thank you.
Thank you, CMO. Thank you, Minister. The next question goes to Janet Silvera of the Gleaner.
Thank you very much, Petra. Could you tell us how you were able to confirm this test, if there are vaccines available for persons with monkeypox? You say that it is close contact, but we know we have large numbers of events coming up this summer. So usually persons who get this pox, you also want them to not be out there. So what is it that we should expect? I know you say you don't want panic, and I'm clear on that. But I want to know if there's a vaccine available. How was it that you were able to test, and if the person came in from the UK as well? Thank you.
I think the population, not just here in Jamaica, but right across the world, should be sensitive now to the spread of diseases through close contact. And in every situation now, it should be part of the new norm that you avoid close contact in order to prevent spread. I mean, we are in a pandemic. And so therefore, we should therefore be avoiding close contact to prevent spread of COVID-19, because we just do not know when a new strain that is going to be a more severe strain will develop. So for everybody who is planning to go out there and party, I should hope that they would bear this in mind, that close contact is still something that is to be avoided, and to use your precautions, the wearing of your mask, the hand sanitizing, hand washing frequently to prevent contact. But I would also say to persons, another message that should have been clear across the COVID-19 pandemic is to stay home if you are sick. And if you have symptoms, the initial prodromal symptoms will resemble COVID-19. And so therefore, persons should be staying home. And then once you recognize that you start to have rash, then there is a possibility of monkeypox, even more reason for you to stay home. So that's the other thing that should be part of the new normal, to stay home if you are sick. In terms of the testing, so Jamaica, in conjunction with some other Caribbean countries, in collaboration with PAHO, has been trained in terms of testing for monkeypox. So we have the capacity in country. Through the support of PAHO, again, we have the capacity for several tests. So we don't have a problem now in terms of testing. Or laboratory protocol and sampling protocol would have been shared over the last couple of weeks in sensitization sessions that we would have had with our healthcare providers. And so they are well aware of what to do. They have the sampling material, and they know how to proceed in terms of contact with the National Public Health Lab. The National Public Health Lab is sensitized to treat these samples with urgency so that we can get a quick turnaround time on the results.
I just want to take the opportunity to really commend the health team because, again, the issue of monkeypox and the potential threat has been on the radar since it was identified in other jurisdictions, and the team has made plans in anticipation for the possibility, which is why we could have had a test done, and the turnaround time was swift. The tests started last evening. I was informed at least a preliminary result, and that's because last month we went through training of our team members and ensure that we had the capacity to test. And again, that was in anticipation before the first case needed to be tested. So I just want to place that on record as part of the reassurance that we are monitoring closely. We have been monitoring closely, and we are prepared and have prepared and continue to prepare for any eventuality, and I think that's important. But you have a role to play your part. I'm talking about the public now, each and every one of us. And if we do that, we don't need to get into the sort of, challenges that we faced with our previous major virus outbreak. Thank you.
Re-vaccines. There's no vaccine that is specific for monkeypox. However, the smallpox vaccine has offered protection against monkeypox. And this, as you know, smallpox has been eradicated for some time. And so therefore, the availability of the vaccine is not really so much across the globe. So there are small quantities that are available. And there has not been a push as yet in terms of any massive production of smallpox vaccine, because there is no recommendation for general vaccination to prevent monkeypox at this time. However, we are looking at the recommendations and the protocols where vaccinations are concerned. We are already in dialogue with PAHO WHO. PAHO has been very proactive in this matter in terms of making initial contact. We were advised from in May of this year that PAHO would have made contact with manufacturers indicating that they are willing to purchase through the revolving fund through which we access vaccines. So preliminary discussions have been taking place, and we are still in contact, close contact, continuous contact with PAHO in terms of availability and, of course, where the new protocols in terms of when it is that these vaccines would be recommended.
Thank you, CMO and Minister. The next question goes to Ms. Janelle Powell of CVM. Janelle?
All right, thank you so much. You're hearing me okay?
We're hearing.
Okay, so in addition to the protocols we employ within the COVID context, if I, for example, present with monkeypox, how will I be treated? And also, as mild as it is it likely to present differently in those living with other illnesses?
Certainly, persons who are immunocompromised in any way will have less ability to fight against any infection. And so we know, if we look, for example, at chickenpox, we know that persons that are immunocompromised tend to have a worse case of chickenpox than somebody who is healthy and will just have the lesions, and within 2 or so weeks they're better. So, of course, your immune state is going to impact on how it is that your body responds. And while it is that most cases are mild, I mean, the possibility of severe cases would probably more than likely occur in persons who are immunocompromised. So immunocompromised persons should always take the necessary precautions for prevention and, of course, ensure that they are looking after themselves in terms of their medical management and, of course, their healthy eating, exercise, and other things to build their immune system.
Okay. Thank you, CMO. We also have a question, CMO, a little bit of clarity on whether or not symptomatic persons are the only ones able to transmit the virus.
Okay, I just remember the first part of the question was how would I be treated if I present with symptoms. So persons who have mild symptoms, of course, don't need to be in hospital. Hospital is reserved for cases that are severe illness that would need some other medical management that can only happen in hospital. So we are looking at isolation at home for persons who have mild illnesses, and they would be followed up by the health department. So persons, if they do develop mild symptoms, they think they have monkeypox, I would advise them to first of all contact their medical provider so that the necessary precautions can be taken if it is seen that they need to come into office. We would appreciate if persons who have symptoms are tested. So if you are having the vesicles, because we are still at the point where we want to see what is happening across country, we would want for persons to come in for testing. So, but we would not necessarily keep you unless you need admission. So, in terms of the other part of the question,
transmission is yeah.
So that is a little bit uncertain. The latest information that I caught up with today had suggested that there is some studies being carried out to determine if persons in the incubation phase, at which point you start to be able to transmit. We certainly know that once persons become symptomatic and they start having respiratory symptoms, then through droplet spread, they can pass it on. And then once they get the vesicles, then the contact with the fluid from those vesicles on your skin will cause transmission. But before that, before any symptoms, we're still not very clear on that, and we wait to be updated on these matters as time goes by.
Thank you, CMO. I see that Jason Cross has a follow-up question. Jason, would you like to go ahead?
Yes, thank you. I want to find out from the CMO or the minister, how should the public transportation sector operate? What is recommended at this point in time? Because, on the buses, in the taxis, people are going to be close to each other.
There has been no adjustment and no consideration of adjustment as to how we operate currently, whether in public transportation or otherwise, except to say, as we have said and have been saying even before the first case was discovered because of COVID, your mask is always a good option if you feel threatened. The distancing where you feel threatened, and if it can be implemented, normally it's difficult depending on where you are, including the public space, and of course the sanitizing. So, we're not prescribing here any new arrangements. What we're doing is creating awareness and explaining and re-emphasizing the approach and just indicating to the populace that the public health infrastructure is prepared and we're dealing with each case, and that the public should take the necessary precaution for their own personal protection. Thank you.
Thank you, Minister. Thank you, CMO. Jason, I still see that your hand is up. Is it that you have another question or? Okay, great. Thank you. So thank you, members of the media. There being no other questions, I will hand over back to our minister.
All right, so thank you very much. We appreciate the members who have come online to ask questions. I think it's important for clarity to be brought to the particular situation and that the information be transmitted through various channels so that Jamaicans are aware, and that, in being aware, we can take the necessary precaution. So just to confirm, one case of monkeypox, person in isolation being treated, close contacts also in isolation. No reason for alarm except to be responsible and to protect yourself where necessary. And if you feel any symptoms, please report to your doctor, whether in the public or private sector. Further information, please go online, Ministry of Health's website, or report to or contact your local parish health office for additional information. If there is a need to keep you further updated on the issue, we certainly will. Thank you very much and have a good evening.
Jamaica. If you are experiencing fever, intense headache, muscle aches and/or rash on the skin, you must isolate immediately and call ahead to your health center or doctor before visiting. All members of the public should wear a mask, frequently wash hands and practice physical distancing. A message from the Ministry of Health and Wellness. Monkeypox is in Jamaica. If you are experiencing fever, intense headache, muscle aches and/or rash on the skin, you must isolate immediately and call ahead to your health center or doctor before visiting. All members of the public should wear a mask, frequently wash hands and practice physical distancing. A message from the Ministry of Health and Wellness.
Hello, Jamaica. I'm Dion Jacksmiller. It's unbelievable to me whenever I buck up somebody who is still asking if COVID-19 is real. Because my doctor died of COVID-19. I had COVID recently, and it was a severe case. Most of my lungs were affected. I am so grateful to be alive. Take COVID seriously, guys. Some people won't be affected, that's true, but others may have long-term effects, and some people will die. Let's do all we can to protect ourselves and to protect